Yes, I did have a opportunity few days back to talk to the PYPA, but probably my heart was there to talk to you children more than anybody else. So let's start with a verse that we all know from Psalms chapter 23, verse 4, which says, Yea, though I walk through the valley of the shadow of death, I will fear no evil, for you are with me. Your rod and your staff, they comfort me. Amen. Praise the Lord. So, this is a wonderful verse from the Bible that we all know of. And this is also very appropriate for the problems that we are going through. So, what are the problems that we are going through right now? I'm sure you all know about the current situation, the fact that you're all staying at home, doing your studies, doing the schooling from home. So, how many of you are actually enjoying it? Let's see your hands. Are you enjoying your time from home? Yes? Or you want to go back to school? It's also my pleasure to talk to you all from the comfort of my home. So, the reason we are all at home is because of this virus. Yeah, and I'm sure we all know the virus. Yeah, and that's called a coronavirus. Yeah, so in medical terms, we call it the COVID 19. And why are we calling it COVID 19? That's because this was discovered in December 2019. So, which is why they named it as a COVID 19. And also because it belongs to this class of viruses they call the coronavirus. So, what is a virus actually? So, these are actually bugs that enter our body. So, these bugs can come from all over and it can go in through your eyes, through your nose, through your mouth. Yeah. And what do the bugs do? The bugs, they can actually attack you. So, what do you get? You will get a running nose, you will get throat pain, you will get cough, etc. I'm sure we are all used to having these bugs every once in a while. All those who are going to school definitely know that these bugs are very much part of the school, isn't it? I'm sure everybody goes through that once or twice, almost every year, 2 or 3 times. Sometimes some children will be even more. But so coronavirus is also a similar kind of bug that unfortunately got into the world, but at a much larger scale, and it has been causing lots of problems for people. Now, do you know where this virus started? Yes, we all heard that it started in China. Yes, it started in China. Yeah, so that doesn't mean the next time you see a Chinese person, you need to call him a coronavirus. All right? It could have started from anywhere in the world, but this time it unfortunately started in China. And then from China, it spread to different parts of the world. And it has come to Dubai also. Unfortunately, there has been a lot of cases recently, and so we are all very much cautious. Yeah, we are all taking care, right? And that's the reason why we are staying home, so that this virus doesn't create trouble for anybody, right? And that's why your parents are also staying home. You see, everybody is taking care so that the virus doesn't get out, it doesn't come into your body, right? So we are all going to look at a few things what we need to do in order to help the society, all of us, to get through this problem together. So maybe some people who have gone through the viral infection, and maybe some people who have recovered also from the viral infection. So it can happen very simple. You can have just a minor cold, a minor flu-like symptom, maybe a little throat pain and some cough. But unfortunately, for some people, it goes beyond that. They get very, very sick, and then they have to end up on something called a ventilator. This is where you put a pipe inside your mouth, and it kind of like helps you to breathe. It's a machine that helps you to breathe. So that's where I come inside. So in my hospital, we kind of deal with all these patients. So we have a lot of patients who are suffering from this particular infection. And once again, the name is COVID-19 infection. So I take care of all these sick people. So I have to see them, I have to examine them. And then, it's not easy to examine. Why? Because if the bug gets inside you, you could be in trouble too. So what do? We wear mask, we wear goggles, yeah, and then we wear this cap. Then we have to put a suit on top of us, and it covers your whole body, and it's not very comfortable. It's actually quite hot inside, and you will be sweating a lot. But then it's for your own protection. So when you go inside, you kind of look like a spaceman who just stepped onto the surface of the moon. And then this is what the patients will see, because you can't even walk straight because it is so stiff. And then you have to put the stethoscope inside your ear, and it comes out into the front of you, and you look like a big elephant who's got a big trunk right in front of you. And then what do? We go and we have to put this onto patients and listen to them. Yeah. Then we examine them. Then what all we do? We have to talk to them. We have to find out how they are doing. So what all we do? It's not only just about talking. We have to comfort them. Do you know how scared these coronavirus patients really are? Oh, they are very scared, because they think that's the end of the line. No. But definitely, like the words I had just read, God is there with us at all times. He's there to protect us. He's there taking care of us. And nothing happens without the knowledge of God. Isn't it? So that's something we Sunday school children should remember. And that's also helping us, because every day morning when I get up and I go to work, suppose if God is not there, how I will be able to do my job? I cannot do my job without God with me, isn't it? So I need God, you need God, and God is there with all of us. And trust me, He is there 24/7. He doesn't sleep. He's really watching us every single moment, every move we make. He's there taking care of us. And He has a big plan for all of us, especially for you children. So I want to ask, how many of you actually want to become doctors? Let's see some hands. Do we have enough hands, or you all want to become engineers, pilots? Yeah? Oh, okay. Who want to be journalists? Nobody? Okay. So why? You think it's dangerous to be with coronavirus? You think doctors are at big risk? There may be a risk involved, but we know how to do it, isn't it? That's what we are trained for. We go through this training period, 5 years of basic training, then further 3 years of higher education. And in between, there are many years of experience that we get by working in hospital, taking care of many patients. So don't worry, when I joined my course MBBS, I thought I can never become a doctor like those doctors that I see. I don't think I'll be ever able to read an X-ray. I thought I will never be able to read an ECG. But then when you study, oh wow, it really makes sense. Oh, that's all? It seems so simple. So then you look at it and you see, oh, being a doctor is not so bad after all. It's quite easy. Yeah? Now, how many of you are willing to change your mind and become doctors? Still no? Oh, all right. Maybe when you grow up, you will understand how wonderful the human body is, and how taking care of this human body is such a pleasure when you are a doctor, that it gives so much of gratitude. When we are taking care of patients in the ward, and you see these patients are so scared, it's so nice to give them a word of comfort, to tell them about the love of God, and through you can actually impart the love of Jesus to help these patients to come towards and experience the joy that you go through every day when you are in the hands of Jesus. Isn't it? Isn't that a wonderful thing? How about when you are flying a plane? You're going to say, fasten your seatbelts and praise the Lord? No. You don't say praise the Lord when you are a pilot. Yes, but when you are a doctor, you can say praise the Lord and give glory to God. So we've been taking care of a lot of sick patients, and there are a lot of treatments that we've been using. So initially we didn't know much about this virus, but lately we know quite a bit about this virus. And we've been quite successful at treating patients. And last 2 weeks, I really want to be, I'm happy to say that all our patients are doing fantastic. Today I just discharged 6 patients, and trust me, they were all so much happy that they were able to, talk to me, and then, I really could encourage them. And it is really a good joy to see what they are doing. Now, regarding all of you sitting there, how are you going to take care of this situation? How are you going to help get over this particular viral situation? Okay, so remember, so what are the two things that you see people wearing every day? You see a mask. Yes, so mask is very, very important. This is not only to help you catching the virus, but also if somebody is sick, it prevents the virus from going from your body to another person. Yes. And the second thing is you need to take care of your hands, because anywhere you touch a surface, and then you're going to catch virus onto your fingers. And then when you scratch your eyes, you touch your nose, or you touch your mouth, yeah, so this virus is going to go inside. So you have two options if you want to prevent your hands from becoming contaminated. One is you can wear a glove, but wearing a glove is maybe not so comfortable, because it can get very sweaty and kind of irritable. Yeah, unless you're working in a hospital, when you have no choice, you have to wear mask when you're on duty. But that's something that we are used to. What's the other option? Other option is very simple. You just need to wash your hands. So every time you go out and you come back home, just make sure you wash your hands nicely. Okay, or if you don't have soap and water near you, you can use one of those sanitizers which your moms carry all the time. Yeah, how many moms have you seen carrying it? Let's see your hands. Oh wow, 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 wow. Oh, you have all such wonderful moms. They all carrying the sanitizer all the time. Yeah, good. So you can put this hand sanitizer and clean your hands every time you go out, you are touching something. So that way you're going to take care of yourself, and you're going to prevent this virus from coming onto you. So you're going to remember whatever I'm going to tell you. Yes, wearing a mask and keeping your hands clean and safe so that you don't fall sick from this virus. Yes. So it's not only for this particular virus, COVID, that I'm talking about. All these viruses can be prevented by taking such care. So what are the other viruses that we know of? So which we all commonly get from school is called the influenza virus. So that's the commonest virus until this particular virus came and overtook and made the influenza virus look like a very small, tiny fellow. Okay, now this COVID has become like a giant. And now, last year, actually, the influenza was the giant. And we never knew about this guy called COVID. But this year, COVID has become the giant, and our influenza virus has become like a tiny kid. Okay, but still, if you take care of your hands, and let's say if somebody is sick, okay, what happens to sick people? They have a running nose, then they start sneezing all the time, sneeze and coughing. Yeah, So what happens? The virus is going into the environment and it can make other children sick. It can make your teacher sick. It can make your parents sick. So how do you cough or sneeze? Yeah. So this is what we usually do. This is, achoo. Yeah. Isn't that what we do usually? We say achoo. Then what we do? Hello. You want to shake my hand? I just sneezed into my hands. Achoo. Anybody want to shake my hand? Anybody want to shake my hand? No, it's not a good thing to do. You cannot shake hands if I just sneezed into my hand, because you may catch some bug, some virus, some bacteria. Yes. So how do you sneeze or cough? Okay, let's all practice this. You sneeze into your elbow. Okay, can you see that? Achoo. Achoo. No, I think your principal did it wrong. It should be into the elbow there, right there. Yeah. Achoo. Achoo. Yeah. So can you shake somebody's hand with this elbow? Here, can you shake your hand here? No? No. So this part is going to be with you all the time. And so you are going to keep everyone safe if you keep your elbow and you use your elbow to cough or sneeze. Yeah. Are we all going to remember this little tip? Once the school will start and we all start going to school and back to Sunday school, and then if any one of you are sick and you want to cough or sneeze, achoo. Yes? You will remember that? Can I see your hands? Oh, good, good. So you're following all what I'm telling you, right? Oh, great, great. Okay. So I want to ask, how many of you are scared of this virus? Can I see some hands? Little scared? Little? Yeah? Okay. So don't worry. All of you children are safe. So this virus is specially made for the daddy and mommy. All right. So children, don't worry. It's a safe virus. Safe in this virus. So
മുണ്ടത്താനം IPC സഭയുടെ സുദീർഘമായ ശുശ്രൂഷ നിർവഹിക്കുന്ന ബഹുമാന്യ ദേവദാസ്, സഭാംഗങ്ങളായിരിക്കുന്ന പ്രിയപ്പെട്ടവർ, എനിക്ക് ലഭിച്ച അറിവനുസരിച്ച് ഇന്ത്യക്ക് വെളിയിൽ നിന്ന് എന്റെ സുഹൃത്തുക്കളും പരിചയം ഉള്ളവരുമായ ചില പ്രിയപ്പെട്ടവർ ഈ ശുശ്രൂഷയിൽ ഈ വൈകിവേളയിൽ പങ്കാളികളാകുന്നുണ്ട്. പ്രിയപ്പെട്ടവരെ ഓർക്കുന്നു, കർത്താവിന്റെ ദാസരുടെ പരിചയപ്പെടുത്തിയപ്പോൾ ഓർപ്പിച്ചതുപോലെ ഷാർജയിലുള്ള ഇന്ത്യ പെന്തക്കോസ്ത് ദൈവസഭയുടെ പാസ്റ്റർ ജോസഫ് നേതൃത്വം കൊടുക്കുന്ന സഭയുടെ ബൈബിൾ കോളേജിനോടുള്ള ബന്ധത്തിൽ അവിടുത്തെ സഭയുടെ സഹശുശ്രൂഷകൾ എന്നുള്ള നിലയിലൊക്കെ ഒരുമിച്ച് ചില നാളുകളായിരിക്കാൻ കഴിഞ്ഞ ചില സഹോദരങ്ങൾ ഇതിൽ പങ്കാളികളാകുന്നുണ്ട്. എല്ലാവരെയും ഓർത്ത് ദൈവത്തെ സ്തുതിക്കുന്നു. നേരിൽ കണ്ട് പരിചയപ്പെട്ടിട്ടില്ലെങ്കിലും ദേവദാസരും ദൈവസഭയും ഒക്കെ ദൈവസന്നിധിയിൽ ലഭിച്ച മുഖാന്തരങ്ങളിലൂടെ കർത്താവിനെ അന്വേഷിപ്പാൻ കാണിക്കുന്ന സന്മനസ്സിന്, ഉത്സാഹത്തിന് ദൈവത്തിന് നന്ദി അർപ്പിക്കുകയും നിങ്ങൾക്ക് എല്ലാവർക്കും യേശുക്രിസ്തുവിന്റെ നാമത്തിൽ എന്റെ വന്ദനം അറിയിക്കുകയും ചെയ്യുക. ഈ വൈകിവേളയിൽ കർത്താവിന്റെ ദാസൻ എനിക്ക് അനുവദിച്ച് നൽകിയിരിക്കുന്ന ഈ സമയപരിധിക്കുള്ളിൽ എന്റെ ഹൃദയത്തിലേക്ക് പരിശുദ്ധാത്മാവ് ഈ വൈകിവേളയിൽ ഇന്ന് രാവിലെയാണ് എനിക്ക് ഇങ്ങനെയുള്ള ഒരു ക്രമീകരണത്തിൽ പങ്കാളിയാകണമെന്നുള്ള ഒരു നിയോഗം പ്രിയപ്പെട്ടവരിലൂടെ ലഭിച്ചത്. ആ സന്ദർഭത്തിൽ തന്നെ ഞാൻ ഇന്ന് പകൽ ഉപവാസത്തോടെ പ്രാർത്ഥനയോടെ അല്പസമയം ദൈവത്തിന് വേറിട്ടിരിക്കുന്ന നിമിഷമായിരുന്നു. ആ സമയത്ത് ഞാൻ ദൈവത്തോട് ചോദിച്ചു, കർത്താവേ, ഈ ദൈവസഭയുള്ള ബന്ധത്തിൽ എന്താണ് ഈ വൈകിവേളയിൽ പങ്കുവയ്ക്കേണ്ടത് എന്ന് ചോദിച്ചപ്പോൾ പരിശുദ്ധാത്മാവ് എന്റെ ഹൃദയത്തിൽ പ്രകാശിപ്പിച്ച ഒരു ദൈവവചന പാഠം, അതിലെന്നെ വളരെ സ്പർശിച്ച ഒരു കാര്യം, കർത്താവിന്റെ ദാസൻ ഈ ആമുഖ വാക്കുകൾ പറഞ്ഞുകൊണ്ടിരുന്നപ്പോൾ തന്നെ ഞാൻ ഇന്ന് ശുശ്രൂഷിക്കുവാൻ ദൈവാത്മാവിന്റെ ഹൃദയത്തിൽ പ്രകാശിപ്പിച്ച് നൽകി ഞാൻ എടുത്ത് എന്റെ മുൻപിൽ വെച്ചിരിക്കുന്ന ദൈവവചന ഭാഗം തന്നെ, അതിന്റെ ഒന്ന് രണ്ട് വാക്കുകൾ തന്നെ അതിൽ നിന്ന് കർത്താവിന്റെ ദാസൻ ഓർപ്പിച്ചപ്പോൾ എനിക്ക് കാര്യം മനസ്സിലായി. നമ്മൾ നേരിൽ കണ്ടില്ലെങ്കിലും, ഒരുമിച്ച് ഒരു സ്ഥലത്ത് ആയിരിക്കുന്നില്ലെങ്കിലും, നാം ആയിരിക്കുന്ന ഇടത്ത് നാം എവിടെ ആയിരുന്നാലും നമ്മുടെ ഉള്ളങ്ങളിൽ പരിവർത്തിക്കുന്ന ഒരു ദൈവ സാന്നിധ്യമുണ്ട്, പരിശുദ്ധാത്മാവിന്റെ നടത്തിപ്പുണ്ട്. ഒരു പക്ഷെങ്കിൽ ഒരേ സ്ഥലത്ത് ഒരുമിച്ചിരിക്കുവാൻ കഴിയുന്നില്ലെങ്കിലും ലോകത്തിന്റെ ഏത് ഭാഗത്തായിരുന്നാലും നമ്മെ കരുതുന്ന, നമ്മെ കാണുന്ന, നമ്മെ അറിയുന്ന, നമ്മെ നടത്തുന്ന ഒരു ദൈവത്തിന്റെ സാന്നിധ്യം, നമുക്ക് ആലോചന തരുന്ന ഒരു ദൈവ സാന്നിധ്യമുണ്ട് എന്ന് എനിക്ക് മനസ്സിലാക്കുക. രണ്ടാമത്തെ കാര്യം, നിങ്ങളുടെ കർത്തൃദാസൻ തന്നെ ആ വാചകം ഈ പറയുവാൻ ഉദ്ദേശിച്ച ദൈവജന ഭാഗം എടുത്തു പറഞ്ഞപ്പോൾ എനിക്കൊരു കാര്യം മനസ്സിലായി. ഇന്ന് ഞാൻ ദൈവം എന്നെ ഏൽപ്പിച്ച ആണെന്ന് എനിക്ക് ഓർപ്പിച്ച പോലെ കഴിഞ്ഞ ആഴ്ച മുതൽ നിങ്ങൾ ഇങ്ങനെ എല്ലാ ആഴ്ചയിലും ഒരു ദിവസം കൂടി വരുവാൻ ഈ മുഖാന്തരം ഉപയോഗിക്കുന്നല്ലോ. അത് ഏറ്റവും അനുഗ്രഹമാണ്. ദൈവം നിങ്ങളെ അനുഗ്രഹിക്കട്ടെ. ദൈവത്തിന്റെ കൃപയാൽ എല്ലാവരും നിറയ്ക്കട്ടെ. എന്നെ ഈ ദൃശ്യമാധ്യമത്തിലൂടെ ശ്രദ്ധിക്കുന്ന എല്ലാ പ്രിയപ്പെട്ടവരെയും കർത്താവ് ഇന്ന് വചനത്താൽ അനുഗ്രഹിക്കട്ടെ എന്ന് ഞാൻ പ്രാർത്ഥിച്ച് പരിശുദ്ധാത്മാവിന്റെ കരങ്ങളിലേക്ക് തുടർന്നുള്ള മിനിറ്റുകളെ ഏൽപ്പിക്കുകയാണ്. പരിശുദ്ധാത്മാവ് തന്നെ നമ്മളോട് ഇടപെടട്ടെ. പരിശുദ്ധാത്മാവ് ഇടപെടട്ടെ. നമ്മളൊക്കെ ഓരോ മുഖാന്തരങ്ങളിൽ മാത്രമല്ല, നമ്മുടെ നാവിനെ, നമ്മുടെ കരങ്ങളെ, നമ്മുടെ ചിന്തകളെ, നമ്മുടെ കാതുകളെ ദൈവം ഉപയോഗിക്കുന്നത് മാത്രമേ ഉള്ളൂ. ദൈവമാണ് നമ്മോട് സംസാരിക്കുന്നത്, ദൈവമാണ് നമ്മളോട് ഇടപെടുന്നത്. അതുകൊണ്ട് ദൈവശബ്ദത്തിനായി നമുക്ക് കാതോർക്കാം.
Getting into this field.
Yeah.
So that's a very good thing.
Many of them want to follow you. Become doctor.
Now you must be having some questions to ask Dr. Salvin. So be ready with the question. I have a few children already ready with the questions. If anyone else want to ask, just raise your hand and we will give a chance to you. Is that understood? Do you have any queries? Do you have any questions for the doctor? Okay. So shall we get Joel? Can you let us listen to that audio clipping? Okay, before we come to that audio clipping, we will go to one of our students, Shannon. Shannon, are you there?
Yeah, yes.
Yes. Shannon, are you ready with the question?
Yes.
Yes, please. Yeah, can continue.
Is why are kids seemingly much more immune to the COVID-19 virus than adults, since I believe there are less number of cases of kids being infected in the UAE and around the world? My second question is, apart from prayer, meditation, a healthy diet and regular exercise and proper hygiene, what are the other points we need to keep in mind during this time, especially since we are studying from home?
Okay, so that's a wonderful question. Yes, so like I said, God has a special point that, you know, he let this virus to be with the adults and he has spared the kids. A lot of studies have been done in that particular point. Kids generally have a much better immunity because of the way God has designed their bodies. So have you noticed that when you fall down, how many days does it take for the wound to heal? It hardly takes a day or two. When you fall down, what happens? You cry, yes? Yeah, you cry a lot. But what happens after an hour? You stop crying and then you are still running around, right? And why does that happen? Because the child's body heals very rapidly, because their cells, you know, the cells of your body, it's rapidly dividing every hour, you know. That's why they are growing taller and taller and taller. Every minute they are actually growing and growing and growing. So because their body has a ability to divide rapidly and heal rapidly, they found that this virus cannot wreak havoc. I mean, so that means this virus does a lot of damage, like real damage to all parts of your body, which is usually your chest. It can happen to your nose and your throat, and it can also hit your heart sometimes, and it can also damage your kidneys. But this virus cannot attack children. So that's a wonderful thing that scientists have really found out. And apart from, yeah, you did mention all the good things that you can do, taking a good diet, keeping yourself healthy, taking vitamins. So what all vitamins do we need to keep us healthy? So 2 vitamins, remember, you need to take. One is a vitamin C, which is found in oranges, which is found in lemon. Yeah. So if your mom gives you orange juice, okay, so for the next 3 months, you should be drinking orange juice every day. Yes, agreed? We agreed to that, yeah? Or she may even give you lemon juice, which is also equally good, yeah? So otherwise, you can take vitamin C, which is found in all the shops outside. So you can get kiddies vitamin C. So for children, there are special vitamin C, which comes as gummies, where you can just chew once a day. The other thing you need to do is, you need to get good sleep every night. Yeah, you understood that? You need to get good sleep every night so that your immune system is in top condition. Yeah. So if you don't sleep, what happens? Your immune system goes down. So that means you tend to get sick. You get a bad cold and flu and sore throat every time you go to school without having a good night's sleep. So who all sleeps early? Can I see your hands? By 9 o'clock? Who sleeps at 2 o'clock in the night? Yeah, anybody? Oh, okay, good. All our children are very early sleepers. Yeah, early to bed and early to rise makes a man healthy, wealthy, and wise. Yeah, so remember that. All right, so make sure good diet, lots of exercise, yeah, keep healthy, active, okay, drink your orange juice every day, and make sure you sleep early in the night. Got it? Thank you.
Georgie to ask the question.
Georgie will ask the next question to doctor.
So, praise the Lord, Salvin Uncle. So the question which I would like to put forward is that I hear people saying that if a person gets affected by the COVID-19 once, he cannot get affected again. So is that true?
Yes, like all viruses, this is also true for COVID-19. This is from all the experience we have up to date. We have seen that those who have been affected by COVID-19 once are not getting infected again. Although there has been reported that there are some different kinds of COVID-19 which has been circulating around the world, but still, till today, at least in UAE, we haven't had a repeat infection. And that's also true for many other viral infections, where what happens, we develop antibodies once we have an infection, and these antibodies will protect us from a second infection. So this is also true for COVID-19 virus. Until now, all the data that we have, it says that, yeah, once you get it, you shouldn't be able to get it. But that doesn't mean you cannot wear a mask outside. You still will have to wear the mask, because it is mandatory that everybody wears a mask. Yeah. Thank you.
Thank you, doctor, for the good answer. Next, our question comes from Jefferson Sabu.
Yes. How did COVID-19 come up in the first place?
Oh yeah, I think you like to read novels, yeah? You
Yes.
like detective novels and theories of, yeah? So for the moment, we know that it originated from a market in a place in China called Wuhan. So what happened was there is an animal market where all these people were bringing all these strange, weird creatures, and they were actually selling it in the market. And see, all living beings have certain amount of bugs in them. So humans have certain bugs, cats have certain bugs, dogs have certain bugs, cow there are certain bugs. But if you know from the Bible, God has said you can have meat from what all animals? Goat, yeah, sheep has been from Old Testament onward, sheep. The cows you are allowed to eat. God has said you should eat cows. Also, you can eat chicken. You can eat fish. Why did God say that? Why did God give us permission to do that? Because these animals have viruses which are not dangerous to humans. But what happened was, even if you remember from the Bible, God had from the heaven, He had put down a basket full of creatures, and the apostle, he refused to eat from that, because God had told not to eat any of these creatures. Why? Because there are bad viruses that these animals and these creatures carry. So what happened in Wuhan was somebody ate a bat, most likely they think they ate a bat which had a bad virus, and it infected the human. So that was not supposed to happen, because this virus, it mutated. So it mutated and it got infected to that human, and that one human started to spread the virus all around the world. Yeah. So imagine one human ate a bat, and today we are all in big trouble. So there has been some conspiracy theories around the world regarding artificial manufacture of viruses, but as of now, it has not been proved. Time and again, if you know our favorite president, Mr. Trump, yes, he's been accusing China of making this virus, but as of now, there is no proof. So it still holds true that bat is the culprit. So do you know of another virus which came from bat and which affected in Kerala last year? You all heard about that? It's called, very good. Yeah. So that's the Nipah virus that also came from a bat. Yeah. So if you see a bat anywhere, but you're allowed one bat, cricket bat. Yeah. Other than cricket bat, don't touch a living bat. All right.
Yeah, I have one more question. Why are citrus fruits good for improving our immunity?
Okay, so citrus fruits like oranges, like lemon kind of fruits, they are rich in vitamin C. And vitamin C is important for repair of your body. Okay, so it's very essential to protect what we call the mucous membrane of your body. So what is mucous membrane? So this is your skin, but the skin inside your mouth is what we call a mucous membrane. So if you don't have vitamin C, this mucous membrane will become very weak, and these viruses can attack this mucous membrane. So what happens if you don't have enough vitamin C? Your teeth will fall down. You know that? All right. So vitamin C is very important to protect us from the viral infections. Okay, so the citrus fruits have plenty of vitamin C, and that's why when mommy gives you orange juice, yeah, all of you will drink it tomorrow. Yeah, let's see your hands. Okay, very good.
We have very limited time, and I already have 4 people in queue. So we'll just quickly run to the question to Kezia. Kezia, please ask your question.
What are the few symptoms of this coronavirus?
Yeah, so it's interesting to note that there are any number of symptoms that can happen. So commonest is start off with most people from what I see in my practice, they start off with the headache, okay, and this headache can progress to a body pain, and then it can progress to a fever, followed by throat pain, and then throat pain becomes cough, then it becomes a breathing difficulty, and that's when really it becomes in a worse condition. But always it starts with headache. Some other people can develop even tummy pain. They can get loose motions, diarrhea, vomiting, and also loss of appetite. And one very important symptom recently we saw is some people suddenly they lose their taste. They have a body ache, a headache, and then they said, I can't taste and I cannot smell. So if somebody says they cannot smell, send him right away to the hospital and get him tested, okay? Thank you.
Next question comes from Joshua Wesley.
Dr. Salvin, why are the recoveries in UAE increasing? And my second question is this stem cell therapy that was announced a few weeks back, is it effective?
First of all, regarding the stem cell therapy, it is not a treatment on its own. It's just helping all our other medications. So we have more than 5 different medications we are using in patients who are sick, and we use these medications based on blood test. So some of these blood tests will help us to guide on which medications we should be using, and also the X-ray, CT scan, etc. can help us to decide which medicine. And some people who have very bad lung problems, when their virus is attacking their lungs and they are having what we call respiratory failure. So stem cell therapy has been found to be effective in preventing the damage happen to the lung. So it by itself, it's not a treatment, but definitely it is helping a lot of patients to recover. But unfortunately, even we know one of our priests recently passed away, although he had received stem cell therapy. But most patients who received it have completely recovered, especially without much damage to their lungs. And the second point is, the question you asked is about the recovery. So what happens is the recovery actually for most patients take about 10 to 12 days on average, even when they are sick. But what happens is to declare them recovered, we have to do 2 times the test for the coronavirus, which is a swab they take from the nose. And usually this swab tends to take some time until it completely disappears from the nose. So that is why the recoveries are usually taking much more time than we anticipated. But lately, because of the accumulation of all the cases which have happened over the past few months, we are finding a lot of recovery which is happening together at this point of time. So you will find a lot of recoveries now, but also the number of cases are also increasing. But hopefully we should recover from it very soon. Thank you.
Thank you, doctor. Next question comes from Rufus Raju. Rufus?
My question is, in most of the people, COVID-19 is entering without symptoms. So how do we understand if we have the COVID-19 or not?
Yeah, so that's a very valid point. Yeah, so there are a lot of these people who walk around with COVID without any symptoms, and that is usually found in Indians. From our experience, we have found that a lot of Indians have the virus without showing much symptoms, and they think that because maybe Indians were exposed to more viral infections in their childhood, and also because of the BCG vaccination. You remember you had that big vaccine which causes the scar on your hand. So that BCG vaccine apparently protects us Indians because we took it in childhood. Yeah. So that big scar you have in your hand, so that kind of protects many Indians. So a lot of Indians are there who walk around without any symptoms. So we don't know. It's very difficult to find out who these people are. And the biggest risk is they might transmit to other people who may be elderly, okay, and who may become very sick with the virus, which is why the government has declared that anybody who goes out, whether he is sick or not sick, he should wear the mask. Okay, so that way we can prevent this asymptomatic people to completely prevent from giving it to other people. But one thing we found is that they are going back to their accommodations where they are living in bachelor accommodations and they are spreading it in their bachelor accommodation. So that is a big risk that has been going on right now. But if they wear a mask, we can prevent it from spreading further. So these asymptomatic people, nothing to worry. They will recover without any problems and they will be immune. So a lot of hospitals are now catching these people and taking their blood to treat the sick people. Yeah. And that is called a plasma therapy. For all those who are interested to know that, it's called a plasma therapy, where these not too sick people who recovered from the virus, they take their blood because there are plenty of antibodies in their plasma. So they use a special device to separate the plasma, which is full of antibodies. Yeah, and you inject that antibody into a sick patient, and it works just like a drug. So the antibodies will help kill the coronavirus. Huh? Thank you.
Thank you, Doctor. I know you all have a lot of questions to ask, but our time is very limited. I have questions only for two more people. One is Jeremy Sam, and the next will be an audio clipping. After Jeremy Sam, we'll go to an audio clipping.
Hello, can you hear me?
Yes, very well.
Praise the Lord, Dr. Salvin, uncle. I have a doubt that, like, if you told that a bat, like the bat was like spreading this COVID-19. So, like, how can a bat have more than like 3 viruses? There is also a virus called Ebola, like came in the like 18th century. Then how can a bat have more than like 3 viruses?
Oh yeah, so this bat is a very tricky fellow. Huh? So he can have not 3, but he can have hundreds of viruses. So bat has been a reservoir of nasty viruses. And have you seen a bat? Okay, and he looks like that. Yeah, so he's a very strong fellow. Okay, these viruses live within him, but he has no problems with it. Yeah, but the problem is, don't eat them. Yeah, if you eat them, you can become sick. Yeah, so it's not just 3. Bats have been known to carry hundreds of viruses. They are a big reservoir of viruses. So it is not healthy to eat either a bat or any one of those creepy, crawly things. Yeah, the only bat you are allowed is the cricket bat. Okay. Thank you.
Thank you, Doctor, for the good advice. So I think most of our answers, you can find it from the Bible itself. What food to eat, what food not to eat. So stay safe, eat safe. Okay. So the last question is, it's an audio clipping. Joel.
Hello. എൻ്റെ സംശയമേ, എൻ്റെ മോന് 4 years 10 months ആയിട്ടുണ്ട്. അപ്പോൾ മോനിപ്പോൾ 3rd ടൈമും കോവിഡ് പോസിറ്റീവായിട്ടാണ് വന്നേക്കുന്നത്. ഫിസിക്കലി കംപ്ലയിൻസ് ഒന്നുമില്ല, ആൾ ആക്റ്റീവാണ്. ഓൺലി കഴിക്കുന്നതിൽ ഒത്തിരി പുറമോട്ടാണ്. വളരെ സെലക്റ്റഡ് ആയിട്ടുള്ള ഐറ്റംസ് മാത്രമേ കഴിക്കാറുള്ളൂ. പിന്നെ കൂടുതലും കഴിക്കുന്നത് ചോക്കോസ്, പാല്, ബിസ്ക്കറ്റ് ഇങ്ങനെയൊക്കെയാണ്. ഫ്രൂട്ട്സിൽ നിന്ന് വല്ലപ്പോഴും ഒരു ആപ്പിള് കഴിച്ചാലായി. പിന്നെ നമ്മുടെ ഫുഡിൽ കഴിക്കുന്നതെന്ന് പറഞ്ഞാൽ ഇഡ്ഡലി സാമ്പാർ ആള് കഴിക്കും. അതേ ഉള്ള ആകെ കഴിക്കുന്നതായിട്ട് വേറെ ഒന്നും കഴിക്കുന്നില്ല. അപ്പോൾ നമ്മൾ മൾട്ടി വൈറ്റമിൻ സപ്ലിമെൻറ്റ്സ് എന്തെങ്കിലും കൊടുക്കണോ? സിറപ്പായിട്ടോ എങ്ങനെയും അങ്ങനെ കൊടുക്കേണ്ട ആവശ്യമുണ്ടോ? ഈ ഗമ്മീസ്, മൾട്ടി വൈറ്റമിൻ ഗമ്മീസ് സിറപ്പിനെക്കാട്ടിലും ബെറ്റർ ആണോ? അതോ നമ്മൾ സിറപ്പ് ആവശ്യമുണ്ടോ? അങ്ങനെ മോന് ഫിസിക്കൽ കംപ്ലയിൻസ് ഇല്ല, പിന്നെ ആള് ആക്റ്റീവാണ്. അപ്പോൾ അങ്ങനെയുള്ളൊരു കുട്ടിക്ക് ഈ കഴിപ്പ് പക്ഷെ ഒത്തിരി ബാക്കിലാണ്. അങ്ങനെയുള്ളൊരു കുട്ടിക്ക് നമ്മൾ മൾട്ടി വൈറ്റമിൻ സപ്ലിമെൻറ്റ്സ് കൊടുക്കേണ്ട ആവശ്യമുണ്ടോ? അതാണ് എനിക്കറിയാം. പിന്നെ വൈറ്റമിൻ സി കുട്ടികൾക്ക് ആവശ്യമില്ല എന്ന് ഇങ്ങനെ കേൾക്കുന്നു. അപ്പം വൈറ്റമിൻ ഡി ആണെങ്കിൽ ഓക്കെ എന്ന്. അപ്പോൾ നമ്മൾ അങ്ങനെ എന്തെങ്കിലും കൊടുക്കേണ്ടതായിട്ടുണ്ടോ?
സോ ഈ പിക്കി ഈറ്റേഴ്സിന് എപ്പോഴും ഒരു വൈറ്റമിൻ സിറപ്പ് കൊടുക്കുന്നത് നല്ലതാണ്. നമ്മുടെ കമേഴ്ഷ്യലായിട്ട് അവൈലബിൾ ആയിട്ടുള്ള വൈറ്റമിൻ മൾട്ടി വൈറ്റമിൻ മിക്സാവിറ്റ് എന്ന് പറഞ്ഞ സിറപ്സ് കിട്ടും. അപ്പം ഓരോ കുട്ടികളുടെ ഏജ് അനുസരിച്ച് അതിൽ എഴുതി വെച്ചിട്ടുണ്ട് എത്ര ടീസ്പൂൺ കൊടുക്കണം എന്നുള്ളത്. അപ്പൊ അതനുസരിച്ച് ഡെയിലി കൊടുക്കുന്നത് നല്ലതാണ്. കാരണം അവർക്ക് ഈ ചില മൈക്രോ ന്യൂട്രിയൻസ് ഒക്കെ ചിലടത്ത് മിസ്സാവാൻ ചാൻസ് ഉണ്ട്. പ്രത്യേകിച്ചും മീറ്റ് ഒന്നും കഴിക്കുന്നില്ലെങ്കിൽ വൈറ്റമിൻ B12 ഡെഫിഷ്യൻസി ഉണ്ടാകാൻ ചാൻസ് ഉണ്ട്. ചിലപ്പോൾ സിങ്കിന്റെ ഡെഫിഷ്യൻസി ഉണ്ടാകാൻ ചാൻസ് ഉണ്ട്. അപ്പൊ അങ്ങനെയുള്ളവര് ഓരോ ദിവസം ഈ ഗമ്മീസും നല്ലത് തന്നെയാണ്. പിള്ളേർക്ക് അത് പലപ്പോഴും കഴിക്കാൻ വളരെ കാരണം ഇതൊരു നല്ല ടേസ്റ്റും ഉണ്ട്. ഒരു ചൂയിങ്കം പോലെ അത് അങ്ങ് ചവച്ച് കഴിക്കുന്നതും അതൊരു നല്ല ഐഡിയ ആണ്. പിന്നെ മോന്റെ മൂന്നാമത്തെ ടെസ്റ്റ് പോസിറ്റീവ് ആണെന്ന് പറഞ്ഞല്ലോ. അപ്പൊ ഇത് നമ്മൾ പലപ്പോഴും കാണുന്നതാണ്. ഇത് പെർസിസ്റ്റന്റ് പോസിറ്റിവിറ്റി. അപ്പം ഈ ഇടയ്ക്കും ഈ കഴിഞ്ഞ ദിവസവും ഓൾമോസ്റ്റ് 2 പേഷ്യന്റ് എന്നെ വിളിച്ചിട്ട് സെയിം കാര്യം എന്നോട് പറഞ്ഞിരുന്നു. അപ്പം എന്ത് പറ്റുന്നെന്ന് വെച്ചാല് മോന്റെ വൈറസ് ഓൾറെഡി പോയിട്ടുണ്ട്. പക്ഷെ നമ്മളുടെ ഈ മൂക്കിന്റെ ഈ സൈനസുകളില് ഈ ചത്ത് കിടക്കുന്ന വൈറസ് എപ്പോഴും ഇതിന്റെ ഉള്ളില് ഒട്ടിപ്പിടിച്ച് കിടക്കും. ഈ സൈനസിന്റെ ഉള്ളില് പല സമയത്തും ഈ മരിച്ചുപോയ വൈറസ് ഇതിൻ്റെ അകത്ത് കിടക്കും. അപ്പൊ ഇതൊന്നും ആക്റ്റീവ് അല്ല, പക്ഷെ ബോഡി പിന്നെയും നമ്മുടെ സൈനസസിൽ കൂടെ പുറത്തേക്ക് ഈ വൈറസുകളെ തള്ളി വിട്ടുകൊണ്ടിരിക്കും. പക്ഷേ ദേ ആർ ഓൾ ഡെഡ് വൈറസസ്, ദേ ആർ നോട്ട് അലൈവ്. അപ്പം പ്രോബ്ലം ഈസ് വെനെവർ യു ഡു ദ ടെസ്റ്റ് യു വിൽ ഗെറ്റ് പോസിറ്റീവ്. അപ്പൊ ആ ടെസ്റ്റ് ചെയ്യുമ്പോൾ അത് പോസിറ്റീവായിട്ട് വരും, പക്ഷെ ദേ ആർ നോട്ട് അലൈവ് വൈറസ്, ദേ ആർ ഓൾ ഡെഡ് വൈറസ്. അപ്പൊ അത് പേടിക്കാനില്ല. ഓൺലി തിങ് ഇറ്റ് ടേക്സ് എ ടൈം. ഇതുകൊണ്ടാണ് ഈ ഹീലിംഗ് ഡിലേഡ് ആകുന്നെന്ന് പറയുന്നത് ഈ കൊറോണ വൈറസിന്. പക്ഷെ ആക്ച്വലി ദ പേഴ്സൺ ഈസ് ഹീൽഡ്, പക്ഷെ ദ ടെസ്റ്റ് റിമെയിൻസ് പോസിറ്റീവ്. അപ്പൊ അതിന്റെ ഒരു ചെറിയൊരു പ്രതിവിധി ഞാൻ പേഷ്യൻസിനോട് പറയുന്നത് എന്താന്ന് വെച്ചാല് നമ്മുടെ ഈ സെലൈൻ സ്പ്രേ കിട്ടും, ടോണിമർ എന്ന് പറഞ്ഞ സെലൈൻ സ്പ്രേ കിട്ടും. അത് മൂക്കിലേക്ക് അടിച്ചാൽ മൂക്ക് നല്ലവണ്ണം അത് ഒന്ന് ഒലിച്ച് അത് ക്ലിയർ ആയി പോകാന് അത് നമ്മളെ ഹെൽപ്പ് ചെയ്യും. പിള്ളേർക്കുള്ള സെലൈൻ സ്പ്രേയും കിട്ടും. ആ മൂക്കിലേക്ക് ആ സ്പ്രേ അടിച്ചാൽ മതി. അത് വളരെ നാച്ചുറൽ ആണ്. അത് ഡെയിലി ഒരു 3 times വെച്ച് അടിച്ചാൽ നല്ലവണ്ണം മൂക്കൊന്ന് ക്ലിയർ ആയി കിട്ടിയാൽ ഒരു പക്ഷെ അടുത്ത കൊറോണ വൈറസ് ടെസ്റ്റ് ചെയ്യുമ്പോഴത്തേക്ക് ആ വൈറസിന്റെ പാർട്ടിക്കിൾസ് ഒന്നും ആ ടെസ്റ്റിൽ കൂടെ കണ്ടുപിടിക്കാതിരിക്കും. അപ്പൊ അത് ട്രൈ ചെയ്യുന്നതിന് കുഴപ്പമില്ല. മൾട്ടി വൈറ്റമിൻസ് ഡെയിലി കൊടുത്തോ. അവിടെ എല്ലാ പിള്ളേരുടെ ഏജ് അനുസരിച്ച് ഫാർമസികളിൽ മൾട്ടി വൈറ്റമിൻസ് ഉണ്ട്. പിക്കി ഈറ്റേഴ്സ് ആയിട്ടുള്ള ചിൽഡ്രന് നമ്മൾ എപ്പോഴും മൾട്ടി വൈറ്റമിൻസ് അഡ്വൈസ് ചെയ്യാറുണ്ട്.
Thank you, doctor. We have one last question. So with this, we end all the questions. I ask Diana to please give your question first. Diana, David.
My question is why is in UAE the cases are increasing in compared to Kerala, and what is the protocol changes that should be implemented in UAE?
Yes, that's a good question. And it's a lesson that we have learned from experiences from different countries. So if you know China, it was a country to be affected first, but they rapidly controlled the spread of the virus because they have a very tough judicial system. Police were very active there, and even the military also came in to help the city that was affected. But if you see that it didn't spread to other parts of China, and that was very remarkable. And what helped was the lockdown. So India quickly learned from that lockdown, especially our Kerala, and our credit goes to our health minister, who was very active, and she also managed to get a lot of volunteers in Kerala who was helping into tracking all the positive cases and tracking all the contacts. In fact, a lot of people were unhappy with that program, but fortunately today, Kerala is in a much better position than other parts of the world. If you see United States and even in United Kingdom, even my friends are saying people are not wearing the mask in United States and United Kingdom. They are refusing to wear the mask, and because of that, there is a lot more cases that's happening in US and UK. But as for UAE, we have been more cautious. But due to there was a lockdown, if you remember, 2 weeks before. But since they relaxed the lockdown, definitely there has been more cases. And the second important thing is that there is more widespread testing of people that is happening in UAE. So initial days, the test was not available very freely because the machines were were less in numbers. There were less staff to do the test, and there was only one center available in Dubai where the test was done. But now the tests are being done in a much wide scale, and which is the reason why more number of cases are being traced, and many of these cases are not very symptomatic, and that's the important thing. But identifying those cases and quarantining them and preventing them from coming into contact with other healthy people will prevent the spread. So it's just a peak that we are seeing now, but soon there is going to be a flattening of that, what we call the curve. So it's going to come down very soon. And the authorities are very worried about the Eid holidays, and there are strict orders not to go from houses to houses to celebrate Eid. And that is a very strict condition the government has put forward. But UAE being a very organized country compared to many other countries, we will be in a much better position to control this epidemic that's happening here. Okay.
Praise God. Thank you very much, Dr. Salvin, for being with us and giving us the health tips and advices in the current situation, the knowledge of the health science and also the experiences in your profession. We thank you very much for that one, and the answers for our dear children. And we thank you very much for that one. May God continue to bless you and protect you. We are praying for you, Dr. Salvin, and your family. And we